Welcome to our podcast, Feeding the Masses from Australia to Baltimore. Our names are Cece, Meg, Ella, Morgan, Josie, and Jameson. Today we will discuss the case study we have been analyzing and will be joined by Linny Khan, founder and executive director of Baltimore Hunger Project.
To start, we will discuss our case study named The Affordability of a Healthy and Sustainable Diet, an Australian case study. The current global food system is in danger of jeopardizing families who rely on it, as well as the environment. Food insecurity is characterized as the state in which a group of people do not have access to a sufficient amount of food, or food which is nutritious. Currently, food insecurity is being aggravated by climate change. Dangers such as climate change are increasing temperatures and causing droughts and wildfires which eliminate the lands which crops grow. Increased carbon emissions also negatively impact the nutritious value of food. Furthermore, agriculture and food production account for 19 to 29% of greenhouse gas emissions. The authors of this case study describe the typical Australian diet, or TAD, as being harmful to the environment, especially due to the amount of meat recommended for consumption by the Australian Dietary Guidelines. A sustainable diet takes the environment into account, but also community, nutrition, and physical health. The Planetary Health Diet, PhD, has been recognized as a diet that is both healthy and sustainable. This diet focuses on the intake of a sufficient amount of nutrients as well as regional and cultural preferences that would affect one's diet. The Planetary Health Diet specifically includes half a plate of fruits or vegetables, with the other half being mostly whole grains, plant proteins, and unsaturated plant oils, with moderate amounts of meat and dairy, and then some added sugars and starches. According to this case study, a healthy and sustainable food basket has not yet been analyzed for its affordability across multiple socioeconomic groups in Australia. The goals of this study were to further analyze the affordability of the PhD food basket for lower, middle, and upper class groups in metropolitan Australia, as well as how the PhD food basket compares in price to a typical Australian diet.
This case study developed a food basket for a family of 4 in Australia. A food basket is a set of foods that satisfy a specific caloric need of a household. Food basket surveys were done at Coles Supermarket for both the Planetary Health Diet and typical Australian diet to see how much a typical family would spend. The typical family was chosen from metropolitan areas because a lot of Australians came from there. The typical family chosen was a family of 4, including 2 children, ages 15 for the boy and 4 for the girl, with 2 adults, 19 to 60 years old. The food items in the basket allowed for dietary variation and were selected from the PHA reference diet using popular brands found in grocery stores in Australia. The cost was determined by using the online prices of items from the Coles Supermarket website. To determine the affordability of the basket, the average salary of a family in Australia was calculated from family income data and census data.
So, from the data collected, the PhD basket for Australians was found to be more affordable than the traditional Australian basket in the metropolitan areas. And the research in this case study showed that diets such as the PhD diet are healthy and sustainable for metropolitan communities in Australia. This is why food baskets such as the one created in this case study are feasible for large-scale retail outlets. And our thesis seeks to explore how food baskets can be environmentally sustainable, nutritious, and affordable all at the same time.
Thank you so much for joining us and telling us about your work at Baltimore Hunger Project. For our global public health class at University of Maryland, we're learning about health interventions, and we would love to learn your background and experiences at Baltimore Hunger Project so that we can relate it to what we're doing in class.
What inspired you to start the Baltimore Hunger Project?
In 2009, I started something called Linny's Garage, which was an opportunity to bring friends and family together to my house to make lunches for 2 women and children shelters. And it was a way for me to do something to give back to the community. I'm a full-time CPA. I'm a mom of 2, and I wanted to do something that was really going to make an impact in my community. So one Sunday a month, we brought together friends and family, and we made 250 lunches that I had the pleasure of taking to one of the 2 shelters. And each Sunday that I would bring the lunches down, the kids would say, "Are you the lunch lady?" And I would say, "Today I am." And this was before Baltimore City provided free breakfast and lunch to the students. And month after month, the moms would share with me how impactful it was for their children to receive a brown bag lunch. So when they would show up at school, they were just like their peers, because living in a shelter, their lives were, complicated and confusing. But to go to school with a brown bag lunch meant that they were just like their peers. And so I started thinking, what happens on the weekends? Everybody talks about Monday through Friday, but nobody focuses on the weekends. And I had read a study that said kids who don't eat over the weekend, it takes them till Wednesday till they can focus on their studies. And I said, I'm a mom of two, and that was something that I still cannot wrap my head around. And so we did Lenny's Garage for 9 years. And in 2014, I decided that I was going to do something about the weekend piece. And I started Baltimore Hunger Project. And I reached out to a school, and we started supporting 30 students in 2 schools. And currently we support almost 2,000 students in 47 schools.
All right, that's awesome. Thank you for kind of sharing with us how it all came to be. We were kind of wondering how you identified the students in need, and if they came to you or if you sort of put something out to the school, and just how that whole process works.
So the students are anonymous to us as an organization. We then allow the school to do their job. They're the ones who interface with the students every day. They're the ones who are able to identify kids who are chronically hungry. And so they're the ones who identify the kids who are most in need. And so what we do is the schools reach out to us and ask us for support. And then through lots of conversation, we talk about how much support they need. Typically, the schools need more support than we're able to actually give. So, for example, if a school has 500 students and their FARMS rates, which is the free and reduced meals rate, is 90%, which would mean 90% of 500 need support. We can't necessarily support that many students. However, we do the best that we can. I think the largest number of students we support in a school is 151 students.
Gotcha. So obviously you guys have a very big impact about reaching schools and students. So we were wondering where exactly the funds and the food come from for the Baltimore Hunger Project.
Probably 25% of our income comes from grants. We do not receive federal funding. Most of the grants that we receive are from national corporations or local foundations. We receive 50% of our income from individual donations. We like to say that each one of our food bags cost about $6.50, and it's approximately $250 to support one student for the school year. We also have packing sessions 3 days a week. So once a week, we have a corporate group that comes, and we ask them to underwrite the cost of the packing session to cover the cost of the food. We purchase our food from the Maryland Food Bank. I would say 70 to 80% of the food that we receive, we purchase from the Maryland Food Bank. Last year, we spent close to $395,000 on food. What we cannot source from the Maryland Food Bank, we purchase at Sam's Club or Amazon. We also receive lots of food from food drives from the community, schools, churches, synagogues, whomever is hosting a food drive.
So in terms of like the actual food packages that you're giving to kids, how do you deliver them to the kids, and when do you deliver them, and like what kind of comes in the meals and stuff like that?
We are in our 9th year, and for the first 8 years, we had volunteers take our food bags to the schools. We package our food in gallon-sized Ziploc bags, and each food bag has essentially the same items. We put in 3 7.5-ounce cans of protein. They're pull top, plus a can of tuna. We put an individual box of cereal, a shelf-stable box of milk, fruit juice box, applesauce pouch, 2 protein bars, fruit snacks, plastic silverware, and a note of encouragement.
Yeah.
We have an amazing partnership with Amazon, and we have, for the last year and change, they have been delivering our food bags. They now send 4 trucks every Thursday to our warehouse, and they pick up our food and they deliver it to our schools. I said we're in 47 schools, we're in 26 zip codes, and they have been doing that, like I said, for the last year and a couple of months.
I have a quick follow-up question for you. Sorry.
Yeah.
So you kind of mentioned the things that come in each bag. Is that sort of the standard that if someone's receiving a bag, then they'll get those things, or can it kind of change depending on needs?
So that is the standard bag. The change is the variety of the cans. So the 7.5 ounce cans, we might have 6 different varieties. So each packing session uses a different menu, but it's always the same type of items. It could be chocolate milk or white milk, different juice varieties. We started a program in 23 called BHP Pantries, where we support schools that have in-school pantries. We also partner with Amazon Fresh, where we get perishable items that come in, and we are able to amplify the school pantries. So if we are only supporting 10 to 15% of the students at the school, we are able to support the rest of the community by providing other items to their school pantry.
Okay, so part of the Baltimore Hunger Project's mission includes delivering educational resources to children and families in need. What do these resources consist of?
So we will put information inside our food bags to let families know where they can receive additional help. For example, if their utilities are being turned off, who they can call for assistance. If they need help accessing additional health care, mental health care assistance, if they need help. During COVID, we were providing information about where free vaccines were available. We connect with different organizations and pass information along to our families. Because we reach almost 2,000 students, we have a captive audience. So we're able to put items inside our Ziploc bags to share with as many. We're able to share really anything that the community gives us inside each of the food bags.
Gotcha. So how does the Baltimore Hunger Project measure success and effectiveness? Like, what assessment tools may you use?
I think it's really difficult for us to measure our success. The teachers can tell us that a student is doing better, their attendance is better, that they're performing better on their tests, and they're less tired in the classroom. But it's hard to separate, is it just Baltimore Hunger Project, or is it the other services that families are receiving? So it's mostly anecdotal. It's information. The success would be that teachers are telling us the kids are loving the bags, that they are sharing the notes of encouragement that they're getting, that they're not ashamed to take the food home, or that there's less of a stigma about being hungry, or that families are readily coming to the food pantry and they're not ashamed to do it. So it's small successes, but I can't tell you that we have any hard evidence that what we are doing is, I mean, in my heart of hearts, I know we're making a difference, but I can't tell you that we have any hard evidence that I don't have any, because we can't. And because they're anonymous and I can't ask. And what we find is families don't want to give information. Many of our families are not U.S. citizens. They don't want to fill out forms. They're concerned that any information that they share with us is going to be reported to a third party. So we work really hard to establish trust with our families, and that's really hard fought. So we're very careful with what information we want to ask.
And then additionally, we wanted to touch on the affordability of the baskets, or sorry, not the baskets, the bags that you guys make. It says on your website that each that explains that $25 can feed one child for a month. And so how are you able to keep your basket so affordable, like the food packages so affordable?
So by purchasing our food at the Maryland Food Bank, that's how we're able to do it. So the Maryland Food Bank purchases food at the quantities that they purchase are so great that they then pass that savings along to us. So for example, I said we put in a box of shelf-stable milk in our food bag, and it's an 8-ounce box of milk. If you were to go to the supermarket and buy that box of milk, it would cost you $1. Of course, with inflation, it would probably cost you a little bit more. If I buy it from the Maryland Food Bank, it would cost me 57 cents because their purchase power is so great. And that's how I'm able to do it. And I'll be honest with you, it's even harder now because the cost of food has gone up. And the cost of food is rising at the same time as our donations are decreasing. And so we're struggling to support the same number of students at the same quality and same level with which we have been doing for a long time. And we had to send an email to our schools letting them know that we have hit max capacity and we are unable to take on more students. And that's a really difficult decision that we had to make because the income is not coming in the same way that it has in the past.
How come, do you guys have a theory as to why the donations have gone down?
So those who had disposable income before are now having to use that disposable income to buy just regular items. And they're having to, their bills are higher, electricity is more expensive, groceries is more expensive. All of the things that they used to buy before, everything is costing that much more money. So the first thing that people stop doing, generally speaking, is making donations to organizations. They're using their money to buy necessities, medication, pay their mortgage, their rent, their car payments. And there isn't a whole lot of leftover money to make a donation to a nonprofit. And I think that's where I think it's sort of it's a circle. So not only we have people in greater need, we have more people who need our services at the same time that the people who are so generously donating to us are not donating to us. So we are in the same position as almost all nonprofits are, where everybody's feeling that pinch. More people need your services, but you aren't receiving the same amount of money to help the people who need your services.
Yeah, it's definitely an interesting point, the roadblock that a lot of people have been experiencing. Mm-hmm. And then shifting gears a little bit, for the school meal plans during the week, they all kind of have these nutritional guidelines. So we were wondering if you guys had any nutrient requirements that your meals have to meet and if they followed any guidelines or things like that.
Nope, no guidelines and nothing to meet. Nope. I had a nutritionist take a look at what we put together, and we're high in sodium, but I think you find that when you're doing canned, non-perishable items. And I'm not happy about that, but when you're talking about trying to stick within a price point, that's a challenge. And we also want to be sure that the food is something that kids are eating. So they're excited to get mac and cheese, or they're excited to get, pasta like SpaghettiOs. And so it's a challenge and it's a trade-off too.
What would you say the primary causes of food insecurity are for the children in the Baltimore community?
That's a good one. I think that's a really complicated question. I think that poverty and food insecurity has been something that has been around for 2,000 years. And I'm not sure what the answer is. I think that there are so many things that could be done, but I'm not sure. I think that there are systems in place that are preventing people from rising above food insecurity. I don't know if you're familiar with, and his name escapes me at the moment. His first name is Matthew. I think it's Redman. He just wrote a book called Poverty, by America. And he seems to think that it is less about the people who are living in poverty that it's more about those who aren't living in poverty, and that perhaps we are to blame for why food insecurity exists, because we continue to hire people and pay them at a minimum wage, at a non-livable wage. And we continue to employ people to work ridiculous hours and in terrible conditions, and we don't pay them well. And I mean, it's just a really interesting take on why there is poverty in America.
Yeah, thank you so much. You provided a lot of great insight, and it's awesome to hear about your work in like the community so close to us.
Great. Well, thank you very much. I hope it goes well.
Thank you so much. Yes, thank you so much.
You're welcome. Take care.
Our case study intervention seeks to create food baskets in Australia that are environmentally friendly, affordable, and in line with the Planetary Health Diet standards. The intervention follows the evidence-based Planetary Health Diet, and it shows success in achieving its goals. Due to its success, its principles could be scaled up to other areas in Australia, as well as other countries. A strength of the intervention is that many factors were controlled, such as the grocery store shopped at, and that clearly proved that the basket based on the Planetary Health Diet is more affordable than the basket based on the typical Australian diet. However, a weakness of the intervention is that they only established one model for the Planetary Health Diet food basket based on a family of 4, and there are no suggestions of customizing it for different family sizes or dietary restrictions. We spoke to Lynn Kahn, the CEO of the Baltimore Hunger Project, an organization that delivers food packages to children in Baltimore to feed them over the weekend. These two interventions are similar in that they have shown success in reducing food insecurity. The food packages in Baltimore and in the Australian case study both seek to remain affordable as well, and that's another similarity they had. The Baltimore Hunger Project achieved this by getting food from the Maryland Food Bank, and the intervention in our case study remained affordable by shopping at affordable grocery stores. A difference between these two interventions is that the Australian food baskets followed strict dietary guidelines described in the Planetary Health Diet, while the Baltimore Hunger Project food baskets purchased more affordable products, which sacrifice the nutritional value of the food baskets. Food insecurity is a long-standing issue, but the interventions across the globe in Australia and at home here in Baltimore show success in different approaches to combat this issue.